I was tagged with
So
listen.
update on the Tamiflu thing. So somebody commented and said, "Get this." I'm not even going to try and pronounce that.
Oscillococcinum.
I stopped at the pharmacy on the way home from work yesterday, and I asked the pharmacist, I'm like, "Do you have this medication?" I show her it, and she's like, "I don't know. It might be in aisle 20, but I really don't know." And I said, "Okay, cool." Like, but I asked her, I'm like, "Is it okay for a 6-year-old take?" She's like, "Yeah." And I said, "They prescribed her Tamiflu, but I just been hearing really bad things." Now, she's at the computer, right? So she's like, "Well, what did you hear?" And I tell her everything that I talked about in my last video. And this is her at the computer, not even looking at me. She's like, "Yeah, I don't know." I said, "Okay, cool." So I go up to one of the girls up front. I'm like, "Hi," show her the screenshot. I'm like, "Do you have this medication?" She's like, "Oh yeah, there's one left." She's like, "Let me show you." Really nice. And she's like, "I love this." She's like, "I give it to all my kids." She's like, "Sometimes I even take it." Um, she's like, "It works great. It's real easy to take." Like, I guess it's like you unscrew the tablet. I don't know. But I told her, like, I don't want to give my daughter Tamiflu. And she was like, "Oh, don't give your kids that." She said, "I won't give my kids that."
There is a ton of misinformation in this video, but I think what angers me the most is that the pharmacist could have actually helped the patient. And I think having worked in retail pharmacy for 11 years, from like very busy stores to not busy stores, I feel like I have some leg to stand on that it really angers me that if a patient is asking a question for a pharmacist to dismiss them. Because as pharmacists, we have a doctorate degree and we are the medication experts. And this was an opportunity to educate the patient about the benefits and the risks of Tamiflu, but then also to instruct them and tell them about homeopathy and oscillococcinum and really how it's not going to do anything. And all this patient is going to do is waste her money. Because I cannot stress this enough that oscillococcinum is just extremely diluted duck liver. And the reason why you're going to feel better after a couple days is because that's just what naturally happens with your flu. It's your body actually making sure that you get over it. And then with Tamiflu, it's really you're only going to see like the best effectiveness if you're taking it within 48 hours of symptoms starting. And of course, if your doctor considers that you're high risk, then you should be taking this. And then the main side effects that I always stress about is the mental health ones. So if that starts to affect you at all when you're taking this, let your doctor know right away.